Tuberculosis, also known as TB, is a bacterial infection that primarily affects the lungs. It is caused by the bacterium Mycobacterium tuberculosis, and it has been a part of Indian history for centuries. In ancient India, TB was known as consumption, and it was believed to be a romantic disease. In the 19th century, TB was a major public health concern in India, with high rates of infection and death. The impact of TB on individuals in India can be devastating. The disease causes severe coughs, chest pain, and difficulty breathing. It can lead to lung damage and, in severe cases, death. This is particularly concerning in India, as it has one of the highest TB burdens in the world, with an estimated 28% of global TB cases. The World Health Organization, WHO, has declared TB a global public health emergency, and India, with an estimated 2.8 million cases of TB in 2019, continues to have one of the highest burdens of TB in the world. The impact of TB on society in India is also significant. In the past, it was a major cause of absenteeism from work and school, and it placed a significant burden on healthcare systems and families. According to WHO, TB is the leading cause of death from a single infectious agent, and in 2019, it killed an estimated 480,000 Indians, a number higher than any other country in the world. The disease also disproportionately affects marginalized communities, such as those living in poverty or those with HIV, who often face barriers to accessing healthcare and have limited resources to manage the disease. In the 20th century, progress was made in the fight against TB in India. The government launched the revised National Tuberculosis Control Program (RNTCP) in 1997, which aimed to provide free diagnosis and treatment for all TB patients. This initiative, along with the use of the DOTS, directly observed treatment short course strategy, helped to reduce the number of deaths from the disease. The DOTS strategy, which involves the use of a standardized, internationally recommended treatment regimen that is directly observed, was found to be effective in reducing the prevalence of TB in India. However, in recent years, TB has made a resurgence in India. The emergence of drug-resistant strains of the bacteria has made TB much more difficult to treat. The disease also disproportionately affects marginalized communities, such as those living in poverty or those with HIV. The emergence of drug-resistant TB, including multidrug-resistant TB, MDR-TB, and extensively drug-resistant TB, XDR-TB, is a major concern in India, and it is estimated that there were around 150,000 MDR-TB cases in India in 2019. The high rate of TB in India has been attributed to several factors, including poverty, poor living conditions, and inadequate healthcare infrastructure. The Indian government is taking steps to address the problem, including increasing funding for research and development of new treatments and strengthening healthcare systems in high-burden states. The government also launched the National Strategic Plan for TB Elimination 2017 to 2025, which aims to reduce TB incidence and deaths by 90% by 2025. The government has also introduced several new initiatives to combat TB, such as the Universal Drug Sensitivity Testing (UDST) of all TB patients and the use of new diagnostic tools like GeneXp machines. In addition, the government has also launched the National Strategic Plan for TB Elimination 2017 to 2025, which aims to reduce TB incidence and deaths by 90% by 2025. The plan aims to achieve this by increasing case detection, improving treatment outcomes, and reducing TB-related stigma and discrimination. The government has also introduced several new initiatives to combat TB, such as the Universal Drug Sensitivity Testing (UDST) of all TB patients and the use of new diagnostic tools like GeneXp machines. These machines use molecular testing to detect TB within 2 hours and are able to identify drug-resistant TB. The Indian government is also working to increase access to TB care in remote and underserved areas through the use of mobile health clinics and community health workers. These health workers are trained to identify and refer TB patients to healthcare facilities for diagnosis and treatment. In addition to government initiatives, there are also several non-governmental organizations, NGOs, and private sector companies working to combat TB in India. These organizations work to raise awareness about TB, provide education and support to TB patients and their families, and advocate for increased funding and resources for TB control. Despite these efforts, there are still significant challenges to be addressed in the fight against TB in India. One of the major challenges is the lack of awareness and understanding about the disease among the general population. Many people do not understand the symptoms of TB or the importance of seeking treatment, which leads to delayed diagnosis and treatment. Another challenge is the lack of access to quality healthcare for marginalized communities, such as those living in poverty or in remote areas. These communities often face barriers to accessing healthcare, such as lack of transportation, financial constraints, and cultural beliefs and practices. This can lead to delayed diagnosis and treatment, which can make the disease more difficult to cure. The fight against TB in India is an ongoing battle, and it will require the efforts of individuals, communities, and the government. To be successful, there needs to be a sustained investment in research and development of new treatments, as well as improved access to healthcare and education for marginalized communities. With continued efforts, we can overcome this ancient disease and ensure a healthier future for all Indians.